Lori, how you doing?
I'm doing well. I had tried to get the invitation to Shauna Viscontis and somehow it didn't get to her. Is there some way we could call her in? I don't know how to do that.
I don't either.
I can forward it, guys. I'll do it right now.
Thank you.
Thank you.
Hi, this is Lisa Beline. Lucia Morrison was trying to log in and she's in a wrong meeting. Could you also send the link to her, please?
No problem.
Thank you.
Thanks, Christine.
No problem.
So it's 1 o'clock and I think we're going to get started here just to be mindful of everyone's time. I am Dina Ottman. I'm the supervisor of the Provider Network team. Good afternoon and welcome to the much awaited rollout of the H2015 and modifiers. Just a couple things to start. When we're going through the presentation, if you're not speaking, if you could please keep your microphone on mute, that will cut back on the feedback and the background noise. And then also, if you have any questions as we go through, you can put them in the chat or you can raise your hand and we will get those questions answered for you. So do we have any questions before we begin? Anyone else need to have a link forwarded, anything like that?
Dina, this is Jillian. I'll monitor the chat and hand raising for you. I know that's hard to do when you're trying to facilitate.
Okay, thank you, Jillian.
Yep. Hi, everyone.
So our presenters today, Jenny Fallis, who is the director of our IT team, and then also Jasmine White, who's the manager of our clinical team, are going to be presenting. But as you can see, we have other members of the OCHN team on the call too. Jillian Trumbull, director of the PNT, and Adam Hamilton's also on the call. He's the manager of the PNT. So just to start, a little background, you may already be aware, but the reason for the change in sundowning the H0043 was that the state decided that they were not able to get good reporting results from the per diem code. Across the regions, people had different rates, so they couldn't tell based on the per diem how many hours were being authorized, how many hours were being utilized. So they thought that going to the H2015 would make the reporting more accurate. And then adding modifiers, of course, helps them to understand the differential in rates when there are 2 people being served or 3 people being served by 1 staff person. Additionally, earlier in the year, the state rolled out the T2027, which is the overnight health and safety code for HAB waiver individuals. And we are starting that for 10-1 also. So we'll be discussing that as well. So are there any questions about the reason for the change? Okay. Hearing none, we can move on. And I am going to share the modifiers on our screen, and Jenny Fallis is going to present on the new codes and modifiers.
Thanks, Dina. Good afternoon, everyone. So I just wanted to kind of go over our modifier document that we've shared with everyone. I'll just wait until Dina can bring that up. Can everyone hear me okay?
Yep.
Yes.
Okay, Thank you.
Can you see my screen? I pulled up the core provider.
It is still the agenda right now.
Okay, let me see if I can close that. Okay. Now, can you see the modifiers?
Oh, it looks like it's switching over. Hold on a sec. It's a black screen right now for me.
All right.
Are others able to see it?
No, black
Still
screen.
seeing the
Black
black
screen. Okay. Some days technology works better than others.
It's not the blue screen of death. It's just the
Yeah,
black
that's
screen.
good.
Can you see it?
No.
Does it have?
All right. All right. Stand by.
Okay.
Now, can you see?
You can see you.
Oh, no. Sorry about that.
Your hair looks really good.
Thanks, Jillian. That's not helping me right now.
Oh, sorry. It does look really good. I was being serious. I like the braid.
All right. Thank you.
You want me to try, Dina?
Yeah, can you please? I'm not
Sure.
sure why it's not coming up.
Let me try.
There we go.
Okay, so maybe I was able to.
Yeah, it's up right now.
All right. Sorry, everyone. Take it away, Jenny.
We've all been there, Dina.
Okay, let me. My screen now is half sharing, I think. Hold on. Okay. Okay, so I know we've shared this document with everyone, and we kind of break it up between, who's going to be entering OS versus what the residential providers enter. The first section just lists all of the fee schedules that OCHN enters into Odin. So those ones we enter under all the residential providers. So when claims come in, we can get payment. They can get payment for all those based on all those modifier combinations. So that those are kind of more just a FYI for you guys. But the section that's listed for core provider are the ones that you guys would enter in your system so you can submit OS to OCHN. So to go over those, we have the H2015, which can be submitted without any modifier. So that would mean it was not a HAB person or an exception. So that would just be a blank H2015. And then we also have where it is for just HK, which would mean it was a HAB person. And then EX for exceptions. And then if they were both HAB and an exception, it would be the EX and the HK. So that would be the 4 different combinations for the H2015. And then for the T2027, which is the overnight health and safety, that would either be HB, which is identifying the person as an adult. And since this is only a HAB code, the HK is not required. So on these 2 codes, it would either just be an HB submitted through the auth or the EX HB for an exception. So all of the new modifiers that identify how many people are being served, all the U modifiers, those will all be submitted from the actual direct service provider when they submit the claim for payment. So at this point, it would just be this section that the core providers would need to enter into their system. So it's kind of a quick update on that. Are there any specific questions?
It looks like we have one person. Is that Lisa Beline who has her hand up? Yes.
Yes, and I apologize if this is a dumb question and I missed something somewhere, but what is an exception?
I will let probably Dina answer that for me.
Yeah, I'm sorry. So we will cover that. That's later in the agenda. And then we can kind of cover what those exceptions will be, what the process is for requesting one. And I think that might be our last item on the agenda.
Okay, I will wait then. Thank you.
I think Sherry Kruger is trying to talk. I'm having trouble hearing you, Sherry. I don't know if that's just on my end.
I heard something, but then it cut out.
And Lisa, your hand, you have to lower it unless you have another question. Just.
Sorry, forgot.
Oh, that's okay.
Okay, so this is Sherry.
Hi, Sherry.
Hi, guys. I've been now in 4 of these team meetings, and there's various, in the email that was forwarded to me, there was multiple team meetings listed. And so there's people in a bunch of different meetings all waiting for this meeting to get started.
Okay, we are not sure what happened there. Do you happen to know who's waiting, Sherry? Elsewhere?
There were, I don't know names, although Amber was there. That's the first name.
Amber was
There
there.
was
Okay.
representatives from TTI and Easter Seals and I think CNS.
Okay, I'm only seeing one link on the calendar, so I'm not sure what has happened here.
I had jumped into that meeting originally as well, and when no one was there, I found this one. So
Okay.
I don't know how I had two either.
Okay. So what I'm gonna do, you know what, Dina, I'm gonna mute myself and stop paying attention for a minute. I'm gonna go pull the meeting link and I'm just gonna send it to everyone who was invited to this appointment. And so some of you will get it again, but hopefully that will get everyone in here.
Okay, Jillian.
Should we pause for a minute or?
It's recorded, so I'm
okay.
thinking you can probably keep going, and if we just need to circle back around, we can.
Okay. So were there any other questions for the modifiers at this point? Okay.
All right, so I am going to attempt to switch the screen back to the agenda. Do you see the agenda?
Not
No.
yet.
Oh, for heaven's sake. Okay.
At least it's Friday.
Oh, tell me about it.
Dina, my screen share was not working for the last 2 days. It's probably just something going on.
Oh, I hope not. Can you see it now?
Yeah, we
Yeah.
can see
Yeah.
it.
Good. Yay. Okay, good. All right. So we will move on then to changes to the benefit plans and some utilization management updates on the new modifiers from Jasmine White. Jasmine, you on?
Yep, I'm here. Thank you. I'm actually filling in for Stephanie. So she gave me an update and I'm hoping I can answer any questions. So at this point, all of the benefit packages and plans have been changed. We did increase the units for H2015, and we increased them quite a bit because our intent is that they don't end up bouncing against UM for specialist review. So the UM team is going to be watching that closely. If it's not enough, we can go back and adjust it. So we'll be watching that. Now, just so you know, we did not remove the H0043 code yet. That won't be removed until 10/1, so it's still in there. But all of the benefit packages should be updated to accommodate for this. And other than that, I don't have any other, those are all the updates she gave me. Are there any questions? Pretty quick.
So Jasmine, did you also want to address like the plans of service and authorizations?
Well, I'm not sure exactly what you guys were looking for in terms of that update. I didn't get that from Stephanie.
I think really what we're looking for really is more questions from the group. If anyone has any questions about how to amend plans of service or how to enter authorizations now that we've gone to a unit code, any questions like that we need to field for the teams.
Yeah, if there's questions, I can definitely, if I can't answer them, I can get those answers if there are.
So this is Sherry.
Yes, Sherry.
And I apologize because obviously I missed the review of number 3, the code. So this may have been answered then. And I'm sorry, I'm perhaps having people repeat something. For support coordination purposes, when they are authorizing H2015, what modifiers are they adding at the IPOS level that allows the provider to be flexible in reporting to accommodate if there's 3 people home that day or 2 people home, vice versa?
Hi, this is Jenny. Those modifiers, all the U modifiers that indicate how many people will be solely on the residential provider to enter. So
Okay.
at the authorization level, it would just be if they were HAB or if it was for an exception.
Okay.
And then for the overnight, it was just the additional HB identifying if the person is an adult.
Oh, thank you so much.
Not a problem.
Because I was not sure how we were going to accomplish that if we had to try and break that out in an IPOS. Now, where would you want in the IPOS then that, let's say I share my supports with 3 people? So, majority of the time it might be 3 people, but some of the time it could be 2 or just 1. How would you want that captured in the plan of service?
Jasmine, are you able to answer that question?
Yeah, I'm thinking, and honestly, I know Christine, you're on, Mary, you're on too
Yeah.
from the IDD network. I mean, I'm trying to think of where you would put that. I mean, I think
Yeah.
it would probably just be in somewhere in the goal area.
Yeah, like somewhere in the narrative, wherever you can put a narrative, like under that specific goal somewhere. I mean, I'm sure we could find it if it's within that section.
Okay.
We don't have anything outlined like
Yeah.
specifically around that right now, but if that's a good point, if something comes up, maybe we can kind of get into that further down the road.
Okay.
And I mean, it shouldn't bump up against too much. If it, I could ask them where they prefer to see it, but I'm hoping we're not going to see that as much because we've already changed those, numbers. So, unless when we're doing reviews, we're having a hard time finding stuff. But for now, I think just wherever you can put it in there in that narrative should be fine.
Hi, folks. This is Lori. So I think I'm following the conversation, but even if you're saying we're not going to use those modifiers in the authorization itself, wouldn't we still put that in the scope of the authorization?
I'm
That
trying
X amount of hours are authorized to be shared
Yeah.
between X amount of people?
I'm in, Jillian, thanks. Tanya.
Thank you. I was just going to text you and see if you got in. Great.
But I'm in, Janine can't hear anything, so I can just add her to the call though.
Okay. Yes. And anybody from your other organizations, if you know of people who are waiting to get in, if you hit the bar that shows participants, you can dial a number in.
Okay.
I'm trying to add people in as I hear it, but if you want to do it, you can too.
Okay, sounds good. Thank you.
Okay. So to go back to Lori's question, I think the scope there now. It's been a while since I've been back in so I'm jumping back in. That is a section that is just narrative, correct? The scope, amount, duration section in the
Correct.
treatment plan. So yeah, I think you can put it in there as well. That would be fine to just make it, alert us to the fact that they have more people that should be fine.
But just again, for a final confirmation, we're not going to be using those actually on the authorizations itself?
Not from the IPAS perspective.
They will not be entered on the auth. They'll be entered at the time of the claim submission by the provider, the drug service provider.
All right.
Other questions about this? Entering auths and IPOS amendments? Okay, so we'll move on to the next agenda item, which is the exceptions. So the exceptions have not changed. It's the same exceptions that we always had for the unlicensed PLS services. And that is if you need 2-to-1 staffing or 1-to-1 staffing with an enhanced rate or 1-to-1 staffing for an individual that needs to live on their own. Those are considered exceptions in which specialist approval would need to be submitted so that the clinical team can determine if it's appropriate. And then we would go ahead and authorize the service. If we need to renegotiate a rate, sometimes we might need an enhanced rate as opposed to enhanced staffing. So we can do that, and it would be handled the same way it's really always been handled. Any questions about that?
Sherry
Yeah.
has her hand up.
Yeah, and I'll try and get it down too. So there are some situations where there might be 3 or 4 people who are sharing supports. And for periods of time during the week, there are 2 caregivers identified to be present to support their plan. So it's not enhanced staffing in the sense of a 1-to-1.
Right.
So you still want that kind of additional support authorized under this or defined within the plan?
That would not go through exception requests. If you've
Okay.
got 2 staff working with 3 or 4 people, that's not an exception. So it would just go through the regular plan and the regular process.
Would we still use the EX modifier?
No, no.
Okay.
The
And
EX
I either
modifier
work
is
at my desk or on the phone. Please leave your name and your phone number, and I will get back to you as soon as I can. Thank you, and have a good day. Bye.
oops.
At the tone, please record your message. When you've finished recording, you may hang
I'm
up
gonna go
or
ahead
press
and mute
1 for
all,
more
and then
options.
people will have to unmute
To
themselves.
leave a callback number, press 5.
Okay.
Okay. Dina, you are going to need to unmute yourself now.
I am muted.
Okay.
So no, that would not be considered an exception. So you would not need to use the EX modifier. So the only time you'll use that EX modifier is if you have to do a specialist approval and there's something out of the ordinary, 2-to-1 staffing or an enhanced rate. Any other questions? Lisa, did I answer your question? I know you were wondering about the exception request. I don't know if that covered it for you.
Yes, thank you.
Okay, thanks. Sherry, did you have another question? Your hand went down, so I'm going to say that's a no.
Because I'm muted again, sorry. So from the provider, how will the provider, or will you cover this somewhere else, know how to bill when it's not 1 staff supporting 3 or 4 people, it's 2 staff supporting 3 or 4.
So I'm assuming that during the course of the day, if you have, let's say you have 3 individuals being served by 2 staff, there's going to be times when those hours are shared, and there's going to be times when people are getting their own 1-to-1 CLS services from a staff person. And because Medicaid requires that they, keep records, they have to keep notes on how the CLS service is being provided during the course of the day. That information should make it to their biller, so their biller knows how many units of each code with each modifier to bill. Does that make sense?
Okay.
I know you sound skeptical, and I understand it's gonna be tricky. I think for the providers initially, it's gonna take some time for them to get adjusted to this new way of reporting. But we'll support them and help them work through that.
And then I think then that similar to what Lori was proposing earlier, we would try to define that as best possible in that narrative portion of the goal and intervention.
Yes, I would agree.
Okay, thank you.
Other questions? I have just one more thing to add to. So I think, and Jillian, you can correct me if I'm wrong, but I think we are still waiting for guidance on the state on how to authorize the T2027 and the H2015 during the night when you've got one person who is on the waiver using T2027 and one person who has H2015, but they're sharing a staff. So we're not, as far as I know, we're not clear at this point if we should be using modifiers or not in those instances.
So that is true. And I know Dr. Lawson is reaching out to MDHHS on a couple of other items. So I can ask her if she can follow up on that as well. When we did reach out, they had stated they were working on guidance. But to my knowledge, that guidance has not come out yet. So we'll follow up on that. Thank you.
All right. So I think that is all we have, unless there are other questions.
So I'm sorry. Finish up.
Jillian.
I was just going to say, I know I just called in several people who missed the majority of the meeting due to the link issue. So I'm not sure if they have anything that they want to make sure they ask, even if it's a repeat before we end. But then I also did want to let everybody know that we did record the meeting, so we can also send out the recording.
Yeah. And additionally, I have put my email address in the agenda. Please feel free to send any follow-up questions to me. And if I don't have the answers, I will reach out to the OCHN team to get those answers to you. So we're not going anywhere. We'll be here.
Oh, and Dina, I had one more thing to add. Just for the fee schedules, they are still being entered and they will all be in by the end of the day on Monday.
Yes, that's right. Thank you. So anybody just joining us want us to repeat anything or go over anything that they missed? Because we're happy to do that.
Hi, this is Pam from CNS Healthcare.
Hey, Pam.
Hi, and I actually just missed actually the whole meeting. So you just mentioned, I hate to ask any questions and bore other people with asking questions. So my question is, will you be sending out the link to the meeting today so I can just listen to that today?
Christine, are you on, or Debbie? I'm sorry, Debbie, can you answer that question?
Yes, we'll be uploading that, and I don't know, do you want me to send you the link or what?
Yes, you can send me the link and I can get it out to everyone on the call.
Okay, will do.
Okay, thank you. Thanks, Debbie. Anything else?
I see Sherry Kruger's hand. I'm not sure if that is a holdover or if you have another question, Sherry.
It's a new question.
Okay.
Clarifying question, sorry.
Sure. No, that's okay.
Yeah.
In regards to the 2017, you've indicated Nicole is seeking direction from the state of Michigan. Are you asking that we hold on all amendments that would fit the description of shared supports between individuals, have and non-have, until we have that direction?
So I think that the question that we have out to the department, and it's one that actually someone at MORC brought to our attention that we hadn't considered, is that there's going to be the shared living situations where some people living in the home may be enrolled on the HAB supports waiver and others may not be. So the overnight health and safety service code is appropriate for people enrolled on the HAB support waiver, but it's not allowable for the people who are not. And the guidance we're seeking is really how to handle that from a billing perspective, knowing we can't report both services at the same time, but two staff are not necessarily needed. So I guess I'm not sure without that guidance how far you all feel you can go. When we reached out to the department, it was already on their radar, and I just haven't seen anything come out. So what do you all think in terms of how far you can go with that? And this will only apply to MORC and CLS because nobody else will have HAB support waiver enrollees.
I mean, for me, September 30th is coming really quickly.
I know. I mean,
yeah. And I know in reviewing, the almost 1,000 people that we're doing this with, there's a lot of situations that fit in that category. So
yeah.
It makes it hard to just continue to tell my team to hold.
No,
Really
and
anxious.
I agree, and we're all very
Yeah.
concerned about the timing as well. We know that this is not, especially for you all.
And not to beat a dead horse, but I too share Sherry's angst. A lot of people are having a lot of angst over this and are trying to get this done to get ahead of it. So I understand that it's a complicated issue, but anything we can do to expedite it would greatly be appreciated.
Yeah, let me, I'll reach out to, I don't think she's on the phone, but I'll reach out to Nicole immediately after this meeting just to make sure she hasn't heard anything. I'm pretty confident she hasn't because she's pretty good about letting us know those things immediately. But see if we can circle back around on that. And then we will have just a quick internal conversation as well and reach out to you all. But from your perspectives, I mean, without that guidance, how do you think you can approach it beyond?
A decision would have to be made is, there's at this point 2 questions. Either you don't authorize the
That overnight
for individuals who are enrolled and would be eligible, although they don't need a one-to-one situation during sleep.
Right. So Sherry, I think what you're saying is you'd just authorize both of those for H 2015 with them sharing those hours.
Yeah. Okay.
Yeah, this is Lisa. That's what I would have thought too, because no one said you can't use that for HAB waiver. It's just that you can't use the other one for non-HAB waiver. So pending the decision, I don't know what else we can do.
Yeah, I tend to think that that's probably how we're going to have to approach it. I'm going to circle back around though, and then when the recording goes out this afternoon, we'll make sure that we sort of clarify where we think we're at with that too.
Thank you so much.
You're welcome. And we know, we know it's a lot to ask of providers in a really short time frame, and we're very sorry about it. So.
And in fairness to you, Jillian, we know that it's not you guys who are holding up the answer.
Okay. I don't know.
Other questions?
I think I see another hand up, but I don't know. Oh, Deborah Danton. Yeah.
Yes, I'm with CNS Healthcare. So are you saying that the fee schedules will be in by the end of Monday? So at this point, we can then start using the TE 2015 in plans, or that's not effective until 10/1?
The codes are not effective. The new code is not effective, and the new modifiers aren't effective till 10/1.
Okay, so then at some point we're going to have to, for 10/1, change all the authorizations from the H0043 to T 2015.
Right. So if you're doing a plan now if you're working on a plan now that starts 10/1, you can start getting those updated.
Okay, thank you.
Mm-hmm.
It's Sherry again.
Go ahead, Sherry.
Lots of questions, obviously, and most of them are coming from my team members, so I'm just kind of passing them through. Has there been any guidance provided to the CLS providers in regards to how they will document differently now under H2015 versus the non-standardized per diem, and how that will interface, using computer terms, right? Interface with adult home health documentation?
So I don't think there should be any change in documentation. They should have been documenting services all along. The difference is, I think, is that they're going to have to make sure that their billers are aware when there's shared staffing and when there's not shared staffing. And then with home health, because it's a separate service, they're just not going to be reporting CLS hours during that time. Does that answer your question, or?
Well, it does kind of, but I'm So historically, under non-standardized per diem, they would start, they would have a narrative note, a progress note that, identified their start and stop time, and it would basically run for the shift that the person worked. But now, under the 15-minute code, they would potentially maybe being provided 2.5 hours of CLS. They would then stop providing CLS, provide adult home help for a brief period of time, and then transition back to CLS. Is the expectation that those narrative notes are going to capture those kind of transitions between funding sources?
So they should. And, we're not going to dictate to the providers how they want to capture that or how they want their staff to document. But yeah, I mean, Medicaid requires that. So they should be documenting like that. Deborah, did you have another question?
I'm sorry, I guess I forgot to put my hand down.
Okay. Other questions? Okay. Not hearing any. So with that, I think we can go ahead and wrap up the meeting. We will get that link and any clarification that we have on the T2027 and H2015 shared supports out to the network this afternoon. And again, any questions, please just forward them to me and I will make sure that you get your answers. And we'll muddle through. We'll get it done. We're good. So with that, everyone has a good afternoon, a great weekend. Take care. Thanks for participating.
Thank you, everybody. Sorry for all of the confusion on the link.
Thanks. Bye.
Have a good weekend.
Thank you. Bye.